Hello, I'm Richard Stewart, and I'd like to welcome you to TV20's Cleveland Health, our program dedicated to discussing and educating our community about critical health topics that directly impact Cleveland neighborhoods. Each episode is designed to inform, empower, and connect you with valuable insights and resources to address the pressing health challenges facing our city. Thank you for joining us as we explore these important issues and work together to build a healthier, stronger Cleveland. Coming up on today's episode of Cleveland Health, we'll delve into critical topics impacting our community, including an insightful interview with Neighborhood Family Practices Director of Pharmacy, exploring the effects of pharmacy closures on patient care, and highlighting the opening of a new location in the West Park neighborhood. We'll also bring you an in-depth discussion on mental health awareness with Scott Osicki, CEO of the Adams Board. But first, we start with Cleveland Public Health Director, Dr. David Margolius, who's here to tell us what you can do if your pharmacy closes. Welcome, Dr. Margolius.
Thank you.
So we've all driven through the streets of Cleveland and seen empty pharmacy buildings, what used to be occupied pharmacies. What can folks do when they find out their pharmacy's closed on them?
Yes, I'm sure it's really just disheartening and shocking to see that your local pharmacy has closed. And the good news is that that prescription that you might be getting there, it doesn't disappear. It will get transferred to another pharmacy, and the closing pharmacy should let you know which pharmacy. But I think even more importantly is to talk to your prescriber, talk to your regular healthcare provider to see where their preference is for you to get medications.
What resources are available for residents who've lost access to their local pharmacy?
Yeah, like I said, I think it's really important to talk to your medical home, your usual healthcare provider, because it is just, as a healthcare provider, when I prescribe to a commercial pharmacy, I don't know if that medication is making it to you or not. If there's a problem with insurance, if there's a problem with medication supply, that commercial pharmacy might send me a fax or call a call center, and that message might never make it to me, and there could be an interruption in getting medications. And so if a prescriber is able to prescribe in their own system, like a neighborhood family practice prescribing through a neighborhood family practice pharmacy, that pharmacist, that pharmacy technician is a part of the team. And so there's bidirectional communication to make sure there's never an interruption in medication, to make sure you get the lowest cost medication, and to make sure that there's no problem with insurance.
Are mail order pharmacies or delivery service pharmacies a viable option for folks who have lost their access?
Absolutely. Mail order pharmacies are really great, especially the local ones. So like Neighborhood Family Practice has their own mail order pharmacy, Metro Health has their own mail order pharmacy, and you can get medication same day through mail order pharmacy and without interruption for refills.
Can residents get any help with prescription costs?
Yes, so your prescribers, your healthcare system will have the best information on the lowest cost options for you. But a number of our pharmacies take advantage of the federal 340B program, and so you'll get the lowest cost possible for your medications.
And where can residents call or contact for additional information if they're kind of off in the wilderness, not knowing what to do?
Yeah, the first call I would make would be to your regular prescriber, your healthcare team that takes care of you, that knows you best, because they'll have all the best options and knowing your demographics, your insurance, your best thing for your health.
Well, thank you so much for joining us. We'll be right back after these messages.
Hello, I'm Scott Osicki, Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. We know that life can be overwhelming, but you don't have to face it alone. If you or someone you know is feeling anxious, depressed, in a mental health crisis, have alcohol or other drug use concerns, or just need someone to talk to, help is available. Call or text 988, the Suicide and Crisis Lifeline. It's free, confidential, and available every day 24/7. Trained and caring counselors are there to listen, support, and help you find hope no matter what you're going through. Remember, you're not alone. Call or text 988 anytime, because your mental health matters, and so do you.
Hello, I'm Michelle Princeton, and I'm a licensed social worker working for the Social Support Service Unit out of the Mayor's Office of Prevention Intervention Opportunities for Youth and Young Adults. The City of Cleveland has demonstrated a long-term commitment to residents working to create safe spaces in our neighborhood resource and recreation centers where families can access free resources and support services. We are committed to working together with families and other community providers to identify and help families who are struggling to achieve a better quality of life. To access the social support services, leave a message at 216-664-2223 and a team member will return your call. Our work includes referring individuals to appropriate services such as medical, hospital-related, long-term counseling, public assistance, veterans benefits, Social Security, Medicare, Medicaid, food stamps, housing assistance, Head Start, and student loans. We also provide support and guidance for youth and young adults in addressing stigmatization, scapegoating, labeling, bullying, substance abuse, and unhealthy relationships. Once again, to access social support services, leave a message at 216-664-2223 and a team member will return your call. Thank you.
Welcome back to TV20's Cleveland Health. I'm Richard Stewart. The closure of local pharmacies isn't just an inconvenience. It's a growing concern, one that impacts access to essential medications and healthcare services. Dominic Hobson and Kate Pasendic discuss the critical role pharmacy access plays in shaping patient health outcomes. Neighborhood Family Practice is exploring strategies to maintain access to essential medications and healthcare services. Dominic Hobson, CEO, emphasizes the importance of supporting affected communities to prevent further disruptions.
I think we're going to continue to see pharmacies closed across our city and our county. And we have to be creative and work across public and nonprofit and for-profit organizations to create creative solutions for that.
Neighborhood Family Practice also aims to make healthcare more accessible and convenient for residents. By increasing services, the organization ensures consistent and reliable care.
Our current location has been at capacity for over a decade. So we have been looking and searching for a while now to find the right opportunity for us to expand. And many of our patients walk to our existing location, so it was important for us to find something in proximity to that location so that we didn't disrupt and create a barrier for healthcare for our patients. And we believe we've been able to do that.
This is a former CVS pharmacy. It's here at the corner of West 130th Street and Lorraine Avenue. It closed last year, but in March will reopen as an expanded Neighborhood Family Practice Health Center, replacing one about a half mile down the road. And in about 12 months, will even offer a full-service pharmacy, replacing the one that used to be here.
We know that the historical model of pharmacies that we are used to, whether that be our retail big box pharmacies or the old mom and pop pharmacies that we saw growing up, that's not coming back. So how can we get creative to make sure that we find other ways to get prescriptions to our patients? And that's going to be a part of our long-term strategy.
Kate Pasendic is the Director of Pharmacy for Neighborhood Family Practice. She highlights the importance of pharmacies and technicians in addressing healthcare questions. When pharmacies close in one area, patients are forced to travel to another location for their medications.
There's also an increased burden on the pharmacies that are left. The patients didn't go down. You know, we have to be able to try to do the best we can to get those patients in the community what they need in a safe, effective way. And it just makes it harder when that access is restricted.
Pharmacy closures also disproportionately impact elderly and low-income communities. These residential areas face greater challenges accessing medications and other healthcare services.
There's a lot of layers to that. There's, like I said, transportation layers. There's also just maybe people won't be seeking care. Maybe they stay home and we have our rates of, emergency room visits or, unfortunately mortality, all of those ratings that we strive so hard to decrease in our communities. When you start to remove access to pharmacies, I believe that goes up.
City leaders continue to address the impact of pharmacy closures. They're exploring new solutions to access essential medications and other healthcare services. Coming up on TV20's Cleveland Health, we'll share even more important information to help you navigate prescription access should your pharmacy close. Stay with us. Now, let's talk about an issue that can significantly affect you, your family, and your friends: the lack of access to pharmacies, which is contributing to a growing pharmacy desert across much of Cuyahoga County. This problem goes beyond inconvenience. It impacts the ability of residents to obtain essential medications, manage chronic conditions, and access critical health services. To explore this pressing issue, I'm joined by Kate Warren. She's Special Assistant to Mayor Justin Bibb, and Dominic Hobson, CEO of Neighborhood Family Practice. Welcome, folks.
Thank you.
Welcome to Cleveland Health. It's our inaugural show, so thanks for being here.
Thanks for having us.
Kate, I'll start with you. What role does the city play in collaborating with healthcare organizations to ensure equitable pharmacy access?
Yeah, so last year, after a number of pharmacy closures, the city decided that we needed to convene a group to really look at this issue. So we pulled together a task force of healthcare experts, pharmacists, advocates, folks in the community that work a lot on this issue. And we had a number of meetings to identify actions that the city and our partners can play to make sure that residents have access to the things that they need that they normally get at Main Street pharmacies. So we really took a hard look at this issue, knowing that there are a lot of things that are outside of our control. We want to make sure that Clevelanders can know how to access the resources they need.
And Dominic, how is Neighborhood Family Practice addressing this pharmacy closure crisis, and what services are you offering to kind of fill the gaps?
Well, the first thing that we're doing is trying to expand our capacity to provide those prescriptions to our community. So we're doing things like delivering prescriptions. We are mailing prescriptions across many zip codes here locally, but we also have a plan to open a third pharmacy that we operate ourselves. So of course, we know that we can't meet the needs for everyone, but we do feel like we can close that gap a bit by providing prescriptions out to our patients.
And Kate, what is the city doing to address kind of the root causes of why these pharmacies are closing, and what steps are being taken, if any, to avoid future pharmacy deserts?
Yeah, so pharmacies are not just closing in Cleveland. We're seeing pharmacies close all over the country. And it's for a number of reasons, mostly market driven. So what we're seeing is the costs of prescriptions are rising. The rates that insurance companies pay to those pharmacies is dropping. Pharmacies are experiencing staffing shortages. And just like other physical stores, as people shop online more, they're seeing a drop in their sales. So lots of reasons contribute to those pharmacies closing. And at the city, we don't have a lot of control over those things. So what we're really trying to do is make sure that residents have access to the information about how they can access their prescriptions. There are lots of ways to access prescriptions that don't rely on those Main Street pharmacies, and we want to make sure residents have access to that kind of information.
And Dominic, what type of advice would you offer to Cleveland residents who find themselves without a pharmacy and other services that they rely on that are offered at that pharmacy?
I would encourage them to start with their medical home or their primary care provider. Many times those providers, those organizations have a better sense of what organizations are available across our community that can fill that gap that we're having with those pharmacy closures. With starting there, they'll be able to get those referrals that they need to continue to access and move on their path towards better health.
And on that same note, how can the city support residents who are on that journey to kind of remake their ability to get medications?
I think a really important thing that that Clevelanders can do if they're wanting to advocate for improved access to pharmacies is as they engage with leaders in the community, as they engage with local and state representatives, to really tell their story about what what access has looked like for them. What costs are they experiencing? What issues are they experiencing as they're accessing their medications? Because that really informs local officials about how they can best act to support residents.
And Dominic, does Neighborhood Family Practice have any specific programs or partnerships set up today that are going to help this problem?
Yes, there's a number of partnerships we have. One of them is with the City of Cleveland, who has been a great partner in our path to open up a new pharmacy that will serve the west side of our city. But the other partners I would like to speak of is our other healthcare providers. We try to be as fluid as possible because when a pharmacy closes, our patients are having a tough decision about where do they move their prescriptions from. And we don't want to be a barrier for that. So we're asking questions like, how can we make it easy, providing them with the resources to know that where their prescriptions are. And then, of course, where appropriate, we are referring and providing those locations to some of our other healthcare partners.
And Kate, what are you telling residents who may call City Hall or end up speaking with you about how to navigate the problem? What are you saying to them?
Well, one, we're working on a couple of resources that we can share with residents. So we want to have a map of the pharmacy locations that are open and really open people's eyes to the fact that it's not just your CVS and Rite Aid and Walgreens that are available to them. There are other pharmacies in communities across the city that are available to residents. And the other thing is we're putting together a frequently asked questions document that can help answer the kinds of questions that residents have. And those documents will be available through our city departments and when you see city staff out engaging in the community. And really, we just want to put that information in the hands of residents in ways that they can access it and use it.
And Dominic, just talk for 1 second about the new pharmacy that will be opening on Cleveland's west side.
Yeah, so this will be our first drive-up pharmacy. Again, we're going for convenience. We know that many people would prefer not to get out of their car, especially when we have the frigid temperatures that we've experienced over the last few weeks. But we'll also have some clinical pharmacy available there. And what our clinical pharmacist does is work and sit down with our patients to educate them about the different medicines that they're on and how they interact with each other and make sure that they have the appropriate dose. So that education is such a key piece of that interaction between a patient and their medical provider. So we want to make sure that we are wrapping around our patients to make sure that they get a true full-scale pharmacy service as opposed to just a prescription without the information around how they should be taking those medicines.
And Kate, where can folks go for additional information?
They can call 311 or 211 first call for help to ask for information. If they use the internet, they can Google where local pharmacies are, or they can reach out to our health department for more information.
Well, thank you very much for joining us, both of you.
Thank you.
And we'll be right back after these messages.
At Cleveland Rape Crisis Center, we believe that everyone deserves to feel safe, supported, and heard. For over 50 years, we have been here to help survivors of rape, sexual abuse, and human trafficking rebuild their lives and to prevent future violence through education and advocacy. Our services are confidential and always free of charge. We provide 24/7 crisis and support hotline for immediate help, individual and group counseling to promote healing, specialized services for children and families, advocacy and legal support to navigate complex systems, prevention education to empower communities, resources and support for deaf and hard of hearing survivors through our Deaf Pathways program, and drop-in center for the on-spot assistance. No matter what you're going through, you are not alone. Call our 24/7 hotline at 216-619-6192 or text 216-619-6192 or visit clevelandrapecrisis.org. to chat with a trained professional. Help is here, and healing is possible. Together, we can make a difference.
Mental health is a critical issue affecting many people in our community. Education is key to knowing who to call and how to seek help for ourselves and for our loved ones. I spoke to mental health professionals from Frontline Service about new ways of responding to Clevelanders experiencing a mental health crisis. Right now, we're joined by Scott Osicki. Scott is the Chief Executive Officer for the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County, also known as the Adams Board. Scott, thank you for joining us.
Yeah, thanks for having me.
We want to talk about this Care Response Program, which is a new pilot in the city of Cleveland.
Yes.
What is it, and how did it come into existence?
Yeah. So what that is we know that the community was asking for a different response to our crises, people in crisis with a mental illness or an addiction issue. So what we found is that we wanted to target certain areas of the city of Cleveland, and those zip codes are 44102 and 44105, and we worked with the city Department of Health on identifying those areas. And what it is a non-police response. So a person would be able to call, and a person with a lived experience or a peer, so it's somebody living in recovery from a mental illness or an addiction issue, along with a behavioral health, mental health, and addiction specialist, a professional, would be able to respond to those calls.
What type of calls do the teams typically respond to? What's the nature of the mental health crisis that they tend to experience?
Yeah, so it could be somebody talking about suicide. It could be somebody, they may be calling for a friend or a neighbor or their family member who is experiencing something that's just not quite right. It could be a person who is just feeling a lot of stress that they would be able to call. It could be a person who is looking for help with an addiction issue of where to get treatment. So an individual would call 988 in order to get in touch with our teams.
So the Care Response Program has been in existence for just a few months now. How has it been received thus far in these early stages?
Yeah, actually, it was we had a soft launch in September. The pilot program will be going until September of 25. So that gives us a whole year to look at the responses. The community really has taken to this already. We've had many meetings with ward clubs. We've had meetings with the community and out in the community in 44102 and 44105. And the response has been really great. So far, since October, there have been about 164 calls to 988 from those two zip codes.
I know one important thing when it comes to mental health intervention is building trust within underserved communities.
Yes.
How do you work to make that happen?
Yeah, so we want to make sure that our teams are diverse. We want to make sure that our teams are representative of the communities that they're in 44102 and 44105. We also want to make sure that the teams are adequately trained to respond to various types of issues.
So now that there's been an intervention within the home, how do you work to connect the patients with wraparound services, things to get them fully healthy?
Right. So part of the response, well, first of all, the issue could be resolved right there and then when the crisis team would come out. But also would be follow-up to that as well. So people would be having a warm handoff to our treatment providers that they have in the community, or being reintroduced back to the provider that they have. So we want to make sure that there is that warm handoff to make sure that the individual is being referred to services and actually going back to receive those services.
So during this pilot stage, it's currently being deployed in two zip codes, 44102 and 44105.
Yes.
Are there plans moving forward to expand this program in other parts of the city?
Yeah, so hopefully we definitely want to do that. That's a part of the pilot program, is to learn from it, learn to see what the community thinks about it, what the response is to that, as well as how can we go ahead and expand this. So eventually our goal would be the whole city of Cleveland, but also our goal would be moving on to the entire Cuyahoga County.
What do you want the Cleveland community to know about this program, why it exists, and how can folks who may be interested get involved in helping?
Oh, sure. So one of the things that we're having a care committee. is what we are developing. We heard during our community meetings and different conversations we've had with public officials and things that the community really wants to be involved in this. So a care committee, that they would be able to serve as ambassadors to the neighborhoods to talk about the care response team, as well as help us tweak it, right? Help us understand what is going on in the neighborhood so we can make the program the best that it can. We received over 70 responses when we put out a search for people to be on the care committee, and so it's really hard to pick, out of those folks. But right now, it's going to be about 18 or 19 people that we will have on that, and those meetings will be actually starting in February, and we'll have them throughout this pilot phase.
Scott, thank you for joining us and sharing this important information about the mental health of our community.
Yep, thank you.
He's Scott Osecki, CEO of the Adams Board. We'll be right back. The Care Response Pilot Program in Cleveland is changing the way mental health crises are handled. Instead of law enforcement, trained mental health professionals and peer support specialists are now responding to many of these calls, some of which are dispatched through 988, a crisis support number for people experiencing suicidal ideation, emotional distress, a substance abuse issue, or mental health crisis.
We've been showing that it's working really well in other cities where social workers are responding to be more of an appropriate level of care for people than a police response for a mental health crisis.
The program's goal is twofold: to provide more specialized care to those in crisis and to allow law enforcement to focus on criminal issues.
We were noticing that law enforcement was responding to a lot of mental health calls, and sometimes they weren't as equipped as a mental health provider to deal with some of the issues that people were facing.
Vigorous training plays a key role in the program, ensuring that responders not only effectively de-escalate situations, but learn to build trust with those in crisis.
We do a lot of training on the front end to try to teach people how to use their de-escalation skills, how to talk to someone who's in crisis, and how to kind of help them to come down so that we can get their brain in a place where we can start talking about solutions.
I'm that guy who can look in that person's eye and figure out what's going on.
For peer support specialists like Khalid Shabir, the work is deeply personal.
What inspired me to get involved was the fact that when I was trying to get sober, I really didn't have anybody that I could really identify with. So I needed somebody to walk me through that journey who had been on that journey. When I engage with an individual, my first question is, hey, what did you eat today? My second question is, how can I help you in this process? What do you need from me? Before we even get into what's really going on with that individual, I offer my services as a human being first.
The program has also inspired new legislation. Cleveland City Councilwoman Stephanie House Jones is pushing forward Tanisha's Law, which would establish a formal Department of Community Crisis Response and ensure continued support for initiatives like Care Response.
There are requirements for collecting data, creation of the Department of Community Crisis Response, and we think pulling all of those things together will really set Cleveland up to ensure that we are sending the right people at the right time based on the crisis that's at hand.
For many, the program represents a lifeline and a critical shift toward care-based crisis intervention.
We're wanting to rehabilitate. We're wanting to take care. We're wanting to help you get through whatever issues you may have.
With its focus on compassion, training, and lived experience, Cleveland's Care Response Program is not just filling a gap, it's creating a model for other jurisdictions to follow in the future.